Hello, my name is Rochi. I'm going to be doing a nasogastric insertion skills video for you today. So the first thing we're going to want to do is we're going to want to determine that we do have a physician's order to perform this nasogastric insertion procedure on our patient. Once we have determined that we do have a physician's order, we're going to then want to gather the equipment that we need for this procedure. So today we're going to need a pair of clean gloves, a pen light, MSS basin, lubricant, a towel or absorbent pad, tape, a 60 cc syringe, pH strips, a specimen container for gastric contents, a cup of water for drinking, a basin of warm water, a nasogastric tube, a stethoscope, and if needed, a suction setup and a suction tubing. Once we have gathered all our equipment, we'll then go to our patient's room. We will knock on the door. We will enter the room. We will close the door behind us to ensure that the patient has privacy. Then we're going to place all our equipment on a clean surface. We're going to then want to perform hand hygiene. After performing hand hygiene, we're going to place a pair of clean gloves Okay, once we do that, we're going to introduce ourselves to the patient. Hello, Mr. Smith. My name is Rochi. I'm going to be your nurse today. Can you tell me your first and last name as well as your date of birth? By me asking this to Mr. Smith, I'm using two patient identifiers. While he's telling me this information, I'm also verifying it by looking at his armband. The next thing I'm going to want to do is I'm going to want to explain the procedure to Mr. Smith. Mr. Smith, the doctor has ordered an NG tube to be inserted into your nose. This will help relieve some of the symptoms you've been having with your bowel obstruction. So what this involves is for me to insert an NG tube or a nasogastric tube through your nose, to the back of your throat and down to your stomach. So after I've explained the procedure to Mr. Smith, I'm going to want to raise the height of the bed to a comfortable working position for myself. And then if the patient can tolerate it, I'm going to put the head of the bed up in a high Fowler's position, and it is determined that Mr. Smith is able to tolerate that. So we will stay with that position at a high Fowler's for that this time. So the next thing we're going to want to do, we're going to want to take our NG tube, we're going to want to place it in a basin of warm water, and then we're going to want to measure our NG tube. So to measure our NG tube, we're going to take the tip of our NG tube to the tip of the patient's nose, and from there to the earlobe of the patient. We'll measure from there, and then from the earlobe of the patient, we're going to go down to the xiphoid process, and it appears to be we're at 50 centimeters. So 50 centimeters will be the point at which we will stop the insertion at. So the next thing we're going to want to do, we're going to place a towel or absorbent pad on Mr. Smith, just in case if there's any like emesis during the procedure, just to make sure that he's clean. Okay, so the next thing, when inserting the NG tube, we're going to want to go with the natural curvature of the NG tube. So when we do this, when we put the lubricant on the tube, we're going to want to slide the NG tube through the right nair of Mr. Smith, slide it in the floor of the right nostril, pointing it to the ear, and then advancing it past the nasopharynx until we reach the oropharynx. Once we reach the oropharynx, this will be the point at which our patient will gag. And just to mention also, when we insert the NG tube, we will have Mr. Smith's head hyperextended before we insert it. So once we have reached the oropharynx and our patient begins to gag, we're going to have Mr. Smith lean his head forward, and then we're going to tell Mr. Smith when he leans his head forward that we want him to swallow, and we will advance the NG tube 2 to 4 inches. Okay, Mr. Smith, we're going to start a procedure now, okay? So what we're going to do, I'm going to put some lubricant on my NG tube. Okay, Mr. Smith, I'm going to need you to hyperextend your head back for me, okay? So I'm going to insert the NG tube into your nose, Mr. Smith. If you feel that you are uncomfortable or anything, please let me know. Raise your right hand, okay? So before inserting the tube, if at any point when I insert the tube, if there's any resistance felt or anything, I will pull the NG tube back from the right nostril, and then I will re-lubricate the tube, and then I will try through the left nostril. Okay, Mr. Smith, I'm going to place the tube in your right nostril now, okay? Okay. Going in. Okay, at this point, Mr. Smith is starting to gag, so... Okay, Mr. Smith, I'm going to have you lean your head forward for me, okay? And then when you lean your head forward, I want you to, every time you swallow, I'm going to advance the tube, okay? So at this point, every time when Mr. Smith swallows, I'm going to advance the tube 2 to 4 inches until I reach the 50 centimeter mark, which we've determined is the point at which we'll stop. Okay, Mr. Smith, swallow for me. Good. Swallow. Good. Good. Swallow for me. Keep swallowing. Almost there. Good. Okay. So once we've reached the point at 50 centimeters where we have determined will be the stopping point at which we will put the insertion tube, or the nasogastric tube, excuse me. Also, just to mention too, when the patient, if the patient continues to gag while I'm doing the insertion, while he swallows, if he continues to gag, I will stop what I'm doing for a couple minutes. I will let the patient rest, take a deep breath. If he continues to gag, I'll have the patient sip some water. Usually drinking a little water will help calm the gag reflex. So at this point, I'm going to take some tape and make a temporary anchor, so to speak, until I confirm placement. And I'm just going to use a little extra tape because I have some lubricant which is making it very slippery. Okay. Okay, once I have that, I'm going to then want to take my 60 cc syringe, and when I want to draw up about 30 cc's of air. And what I'm doing here is I'm checking the gastric contents. So I'm going to unplug my, or unclamp my NG tube. I'm going to want to instill 30 cc's of air, and then I'm going to want to pull back about 5 to 10 cc's of gastric contents. So I'm going to blanket and then clamp it back. Take my specimen container. I'm going to put the gastric contents into my specimen container. I'm going to then take one of my pH strips. I'm going to put it into the gastric contents and determine the pH of the gastric contents. According to facility policy, some facilities might be 1 to 4, some might be 1 to 5. So for this video, we'll say that the gastric contents is 2. So that means that it is in place as far as for the gastric contents. And to determine whether we do have correct placement, not only do we do the pH of the gastric contents, but for a more, how shall I say, correct placement, we're going to want x-ray to come and do an x-ray of the patient and make sure that the placement of the tube is really in the correct area. And that is probably the most accurate compared to doing just the pH and the gastric contents. So then after this, we're going to want to document what we did. We're going to document the tube size that we put in the patient, what nair we used, the drainage or the color of the gastric contents, also the amount, that is if we, once we've determined the placement and placement is good, if we do end up attaching the patient to low wall suction or intermittent suction, for the plan of care, we're going to want to also monitor the output of the patient as far as the gastric contents, the color, the drainage, the amount, and then from there we will again document the tube size, the nair we use, the drainage color, the amount, as well as the time, dates, and then we'll also document if the how the patient tolerate the procedure, and then from there we will once we've confirmed placement, we will take a I don't have a clip right now, but we would either use a clip or a safety pin depending on the facility's policy and procedure, but for now we'll use tape. We'll secure the NG tube to the patient's gown, and then from here, as I said, if needed, once placement is determined to be correct, we will connect the patient to suction if we need to, and then from here we will clean up our mess here that we've made, and then we will take off our gloves. We will perform hand hygiene, and we are done.